This is an actual action plan. This is a very unique approach. This is actually from the diverse voices and community across our state. This action plan comes from over 600 Delawareans who helped us put pen to paper to come up with both short-term and long-term actions. And so you'll see that this is our initial launch pad to address in Delaware the behavioral health system that is fractured and has significant substantial gaps. So we went up and down our state listening to families, and as all of you have heard, every one of our families addressed issues from the cradle to the grave. We were listening to persons with autism to Alzheimer's, but the elephant in the room is obviously the opioid heroin addiction, and that is our first year's major area of focus, is on addressing the addiction crisis that we face in this state.
Our families and individuals are exhausted. They're exhausted and they're tired. They've been trying so hard to fight for their loved one, to fight for themselves, to get access to treatment, to get access to mental health services, and we need to do better. This consortium roadmap will be an important part to help us get moving, and we cannot stop because we have to help and engage those who are also afraid to come forward.
I think the key takeaway point is this is just not a report. This is really an action plan. And our job now is to prioritize those action items and to get to work. And as Representative Bent said, he's confident that here in Delaware we have the will and the wherewithal to do exactly that with the folks that have been involved in the consortium, with members of the public for whom this is a huge issue, and it should be for all of us, as whether you're talking about mental health challenges and trauma in elementary school, whether you're talking about the need for substance abuse and mental health treatment for those who are incarcerated, or where you're talking about the terrible scourge of the opioid epidemic in our state. This plan, this 3-year plan, is also important to point out, is an action plan, and it sets forth those action items that we should entertain right away. There's been mention about the continuum and the system of care and access to effective treatment and services. Those are things that need to be developed. Oftentimes they don't come about overnight. And so this is going to be a long-term commitment, initially, as the Lieutenant Governor said, to stop the bleeding, and then to put in place a system that deals with this terrible scourge across our state.